I'm different in that I'm not a traditional medical student. I was considered a non-traditional medical student, and what I mean by that is I didn't grow up as a child thinking that when I got older all I wanted to do was be a doctor. Actually, my bachelor's that I earned at Ohio State is a double major in computer science and German language. And my first job was working on the guidance navigation flight control software for the space shuttle with NASA. And I've worked for, I guess, 4 different Fortune 500 companies, IBM, Lockheed Martin, Boeing, and then there was a consortium. The last one I worked for was a consortium for Boeing and Lockheed Martin called the United Space Alliance, and this was down at the Johnson Space Center in Houston, Texas. So I was a software systems analyst, systems engineer down there, and I came to a crossroads in my career where I found that I was working less with bits and bytes and I was working more with people. And I could either stay there and become a manager, or I could go back to IBM, because at that point in time I was working for United Space Alliance, and continue doing systems analysis, systems engineering, like project management. Or I thought, well, I could do something different because I was looking for a challenge. And given the fact that I was working more with people at that point in time, and also one of the most rewarding parts of my career was the realization that the lives of the astronauts depended on the software that we coded and that we evaluated and reevaluated and changed over time. I thought I wanted to make a change, and so I decided that I wanted to be more involved with people and actually have great responsibility for their lives. And the one thing that came to mind was medicine. So that wasn't something that just happened overnight. I had to plan for that, because I had to go back and retake a bunch of courses, information, most of which I'd forgotten because I wasn't using it, and then I had to take courses that I hadn't taken, and then eventually it came time to apply to medical school, and I did get in. And then I had to sit back and figure out, was that once again what I really wanted to do, because I was going to give up everything that heretofore I had done, and I was going to have to restart. But ultimately that's what I chose to do, and I started down that path, and yeah, I haven't regretted it since that day. I haven't thought that it was ever the wrong decision. So the upshot is, medicine allows me to, number one, serve people and to help them in their lives, to make meaningful changes in their lives, and then number two, I find it incredibly intellectually stimulating. The most rewarding aspect of my job as a doctor is just the people. Ultimately, it's the people. I tell patients again and again that I love my job and I love my patients, and just being allowed to be part of their lives and to be able to make that difference here and there. And it doesn't have to be a huge change. I mean, sometimes it is, but most changes in life are really small changes. To be able to facilitate that, I mean, really when it comes down to it, it's the patient who has to end up doing it. But I get to be a part of that. That's the most rewarding thing. Honestly, I'm in St. Charles County because when I went to medical school, my wife went to law school. Medical school is 4 years and law school is 3 years, and so she ended up graduating a year prior to my getting out. And when she got out, she started working with a firm that's in downtown St. Louis. And so then when we were looking for places for me to do residency, I ended up going to Mizzou, University of Missouri, family medicine program there, family and community medicine. Because she, number one, because she could telecommute to her job in St. Louis, but also she's from Iowa and I'm from Ohio, and it ends up that you go either way, and from St. Louis, it's about 7 to 8.5 hours to anywhere that you need to get to in either of the 2 states that we'd be going to. So that's why I'm in St. Charles County. I did my bachelor's at Ohio State. I did my medical school at Medical College of Ohio, which is now University of Toledo. So ended up getting an education actually at both state schools. And then actually my residency was done at University of Missouri, so that's state school too. Reading, mostly science fiction and fantasy, although biographies are good. Movies, biking, personal hobbies. I don't get to spend a whole lot of time on personal hobbies these days because I have a 7-year-old and a 9-year-old, and I'm a den leader in my son's Cub Scout pack here out at Darden Prairie. And then he's involved in taekwondo and softball, actually baseball, and then my daughter's involved in gymnastics and Girl Scouts and soccer. So really when it comes down to it, yeah, I do have my personal hobbies, but I would say probably the personal hobby that takes up most of my time is actually my family hobby, and just being part of my kids' lives and participating in that.